Yeah, and just you've got the screen up there, have you?
Yes.
Yeah. So I haven't reviewed any of this stuff, so I'll just
Okay.
see what we've got. I'm just doing it on the brief description I use. And this is something I don't see very much of, which is golfer's elbow.
Oh,
Just the rather than the uh,
yes.
stop it at a reasonable spot. Now, there is, when I've looked back at these things, there is a bit of a lag between what you see and what I say. So if my arrow's in the wrong spot, that can be it. This is the medial epicondyle, and this is some classic golfer's elbow, and a
Yes.
tiny fleck of calcification there. Not the most exciting thing, but I just thought I would save that clip because you really you see it a lot less often than you get asked to look at it. Often it's normal, and what they've got is some irritation, either of the ulnar nerve just behind it. So
What is the origin of that density? Is it just
I
reactive inflammation, or is that debris from the actual enthesis, or it is what it is, let's move on?
yeah, I think that would be my call. I would say,
Okay.
it's we're not going to get a black and white answer for that, because I think it can be all of those things. And you'd question whether, even if you had histology, they would be
Yeah.
able to tell. Uh, Certainly in that quantities. You've got in there gout, pseudo gout in the mix, but actually, when you see it in small quantities like that, I think it is just a bit of granulomatous tissue. You could have hurt yourself once upon a time, or it could be just a tiny seed of calcific tendinosis. Uh, but I would go with just old age and you know injuries. Now, what are you seeing here?
I'm seeing what looks like a very reactive hypervascularity is it the dorsum of the wrist?
Yep, spot on. And in sheath of one of the tendons,
Yes.
they're running over the top. So quite a hairy one.
Wow.
Yeah.
So what do you do with it? Do you inject it?
Um, in on this list, no. I say uh, typically
Wow.
this will have come from the rheumatologist and saying, bit of swelling, we're not quite sure what's going on. I suspect this patient was under some sort of uh, was question mark rheumatoid or question mark wrist pain. Uh, is there an inflammatory component? And to which the answer is quite simple.
Hey, answer me this. The logistics of a general machine,
Yeah.
how do you refine and maximize the beauty of what you're showing us here? Meaning, I assume you click Doppler, and then they're going to have about 2 to 6 different options to click then. But
Yep.
and then
And
talk me through that.
well, it's in reality, uh, if you're in a classroom and it depends very much on the machine you've got. Modern machines have a wide variety of options in terms of what they've got. Hang on, just let me move this over here so I'm pointing towards you at least when I talk to you. It seems rude not to. Um, but uh, but yes, every every device is different, particularly manufacturer to manufacturer, as to which systems work best. There are a lot of new systems that are purportedly show vascularity better, but that will be dependent on condition to condition. Whether it's low flow, high flow, uh, close surface or not. So it's being familiar with the kit on your device that is, and how you optimize that. Now, traditionally, when you're looking for inflammatory arthropathy, everybody uses something called power Doppler, which you'll be familiar with, the typical orange, monochrome orange uh, thing. I don't personally use that at all. I prefer to use uh, this traditional color Doppler that you see on your picture here, where you actually have directional flow. Now, that's just my personal opinion. I think that the actual argument for using power Doppler versus color Doppler is the way that the signal is interpreted, because it is the difference is at post-processing. What they use similar, or typically a similar pulse to create that, and what the power Doppler does is it doesn't use direction of the flow. It just uses the amount of Doppler change that it sees, and it just presents that on the image, which should, from a simplistic understanding of it, I think, give you a more sensitivity. Now, I think in practice that doesn't work as well. And I have, over the years, I've always put the color Doppler on because I prefer it. And then when I see it or when I don't see it, I've often flicked on to one of these other options and seen if I can find it when I couldn't find it, and vice versa. And I still find just the basic color Doppler on the devices that I use still gives me better functional sensitivity, which is what you want.
As we're looking at this, what looks like cloudy color in this
Yeah,
picture here, this
yeah,
is not a large plumbing of a large vessel. This is a summation of capillaries or microcirculation that is flowing either toward or away from the receiving probe.
yes,
Is that
yeah,
correct? So
yeah.
this,
These are small individual vessels. What you see when you see this stretch here, that will be a small vessel. It will be nothing like the size of what how it appears on the image.
it
Uh,
could be 100 or it could be two.
no, it will be one. It will be
Oh,
one vessel giving you this signal there,
oh,
but the size of it will not be properly represented on there, because the color signal does not have is deliberately not focused in the same way. And so
oh.
that there, to an element, it's focused in the same way, but it doesn't have the spatial resolution. And so the size of that vessel is not the size of that color signal is not necessarily the size of the vessel.
Yeah. I was seeing this and was thinking that there would be microscopic circulation that this summed to a mass effect. But what
No,
you're seeing is that there's probably in this picture two to six vessels that are
there will
giving
be
us this.
there is a vessel there. There is a vessel there, probably with branches, though I'd have to look more closely. And there's a vessel there that may or may not split into two at some point. Here, there may be more than one vessel, or there may be just one vessel creating a bit of noise. And I am not trying to check that. I suspect there are two
Yeah, yeah,
vessels
yeah, yeah, yeah.
moving in different directions, one going up that way, one coming this way, or the other way. I really don't care when I'm doing this. That's
Right,
not examining the
right,
architecture of the
right.
vessels. I'm looking for their presence and the amount of.
I know that I see postings in various social media platforms where it sounds like the presenter is boasting a little bit by the level of processing that they have on the Doppler, and it seems like there has been some advances in the area of Doppler processing, back from what I knew. So I don't. I wished I were a better connoisseur of all that new stuff. But I'm looking at this saying, I'm assuming you took this up to full white out or yellow out, and then backed it down to a level of where you were confident it was
Yeah,
showing the relevant circulation.
that's in essence. I probably mightn't have thought too much. I like a noisy picture. So my color pictures are not very pretty. So
Yeah.
there is always quite a lot of noise in my picture, which is why I see things flaking around.
Wow, that's just
And I
amazing.
am and I am comfortable with that. And so it doesn't give me textbook pictures, but I will mentally separate out the color from the noise, and that allows me, I believe, to be more sensitive. So I drive through all the snow and flashing things because I feel I can recognize what the real stuff from the less real stuff, and the higher you have the sensitivity, the more of the real stuff you will see. So you're always battling this signal to noise, and I'm prepared to put up with a little bit of noise to give me extra sensitivity.
Last question, and then I want to move on. This compared to a normal wrist or to the
Yeah.
contralateral side, would it have any coloration on a normal side?
Right. So if we go back to, did I get any grayscale, or I think I've only recorded the color picture. Let me see. Maybe I've got a bit. No, I've got a bit more. So I've really just been looking at the color. So we'll have to look at the grayscale through all that color noise. So this, I think, if I can be, I'm not going to be positive on this. This area here, if you can see where my arrow
Yes.
is the capsule of the dorsal recess of the wrist here.
Yes.
And that looks a little bit dark, if you can imagine what it probably looks like without that color on the picture. Yeah.
Yes.
And slightly swollen. Now, that is very common even in relatively normal people without the color going through it. So I wouldn't jump up and down and assume that. But this bit here, which is in the recess, the dip that you get in that bell shape, of the capitate, when you look at the capitate in long section, that is, for me, is an immediate flag for an inflammatory arthropathy, because you don't see that swelling there in that one. Now, we might even get another case later. But that swelling there, that dark swelling there, in a relatively normal shaped wrist is an unusual feature not to be associated with inflammatory arthropathy. So yes, so the swelling here, and then I think if we go back through, where do we hit? Yes, if you try and read this is at the wrist joint here, with possibly just the edge of the capitate there in the picture. This is slightly the wrong shape. You see, though the capsule can be a bit thicker here, the fact that it bulges, that it's sort of bulbous and has swollen rather than just being ragged and thick, is all suggesting to me, before I put the color on, that actually this story's got legs.
I gotcha.
Yep.
But if you were to take this probe configured this way and simply picked it up and put it on the contralateral side that did not have inflammation, would there be any of this coloration on
No.
that side?
No.
There would be none.
There would be none.
Okay.
Typically.
All right. I'm done laboring this. Thank you for your time.
Yeah. Cool. That's all right. Let me just get check. Yeah. So what are you looking at here?
Oh my goodness. I would have thought that was like the plantaris.
Yep. It's right on the money. You've done this before, haven't you?
Well, come to think of it, oh, good grief. I looked up to the right and saw your wording now, honestly. For anyone who's watching this, they're going to go, yeah, Fritz is just reading the caption up there. But I did not.
Yeah, well, we only have you won't do, because we only have 4 degrees of vision. That was what I was always taught. You
There
only
we
really
go.
see what you're what's right in front of your nose. Why you have to pull your eyes around. So yes,
So
I
what
have
do
a
you
cat.
make of this, John? Is this an inflamed
I
one
have.
or
I'm just going to see. I'm just going to go to the end just to see whether I've got a better story. Yeah. So this is an Achilles rupture, and probably the proximal part of the scar is
I see that.
of the tendon is here, and the distal part is here.
Yes.
And this is all, you can see what, when I was scanning, it looked like cystic pockets still here,
Yes.
but some
Yes.
fibrous tissue coming across them. And when I moved it, it all sort of moved together. So I would expect that gap in the space there is, if I measure with my fingers, it's going to be about 2 centimeters. So this is being treated conservatively. It is starting to knit together. I think it will probably knit together long. So they will be left with a long Achilles. So a nice flexible ankle, maybe not great to push off. And that's not an uncommon story. But when you look at that in comparison with the with other factors, you're never really sure where it is. And I say there's a little bit of swelling tracking up along the track of the plantaris here, and I'm also not sure if the plantaris is injured. I'm pretty sure that is going to be that if the plantaris is injured, it's actually more proximally. But my picture quality is not good enough to show that. But that was my suspicion, was that maybe, and that could have happened after the event or at the time. But yes, a little look at plantaris, not conclusive. And if we go, and I'm just picking out stuff that I'm confident we've not done it. This is something I see a lot of, because in the UK, people often have to wait quite a long time for a scan. So it's not something that happens straight away, even after they get to see the doctors. But this is an olecranon bursa. You see that just here? But this is resolved. They go to the doctor when it's all swollen.
Yes.
And then so they stand out, and then by the time they come to scan, it's almost disappeared. And I say, well, I'll just have a look anyway, make sure there's no signs of a foreign body. Really, the only thing I'm really looking for as to something that's caused it to become inflamed. And then you come through here, and you can see just about, I hope, a little bit of resolution there, a little bit of thickening there of the lining. But this has all stopped being inflamed, and it's just all calmed down. But not an exciting scan, but nice to have seen it and to recognise that it is there. Now, let's see, what else have I got this date? 14. Yeah. Snapping on the nerve. Okay. And so, what are you seeing here?
Yeah, I can. Well,
it's all a bit fuzzy, isn't it? Hopefully, I can see that.
oh, there we go.
Yeah, there's the ulnar nerve just popping across.
Yeah.
Now,
And you're basically
I think,
flexing, extensing?
yes,
Flexing.
yeah. And what I find when I scan these is that you see that, and then it isn't always the case. And it is very much, the camera's not ideally positioned for this. I move the camera down a bit, which I don't seem to be able to. Sorry, I'm experimenting with a new
it's fine.
kit, and it's the first time I've used it. Now I'm going to have to hold my arm up here. If the arm is in this position, it will often snap. And if it is in a more neutral position, when you flex the arm, it doesn't snap. Now, I'm sure there might be cases when it's the other way around as well. But, just something I would say to note from a clinical point of view is that if you're assessing for snapping on the nerve, I don't presume that if it doesn't snap, or if the patient's getting pain there, and you can't really see a reason, if perhaps it's perhaps subluxes with the arm in neutral, and you can't see my arm now. But if it's in the body line and you flex it and it just moves nicely out of there, you'll find that as you raise it up to this position and then do something similar, perhaps in a more functional position, and they're wondering why it's really irritating when they do this, but when you test it, it doesn't seem irritable. It's often because they snap in one and not in the other.
Isn't that interesting? I'm trying to think of the loads and the vector, forces on it as to what would do that, and I don't know.
I suspect it is just the tension in the it's under a different pull is the direction of the pull is slightly different, and so it doesn't go, and there's the epicondyle probably resists the medial motion of the nerve. I forgot, can I get it to where it happens? Whoops, where there? Flicked across.
There we go. Yeah.
looking across there. Yeah.
And this person would have come with a complaint that made you say, that sounds a lot like an irritated ulnar nerve
They
from that.
they come for all sorts of reasons, and often they're not specifically coming for that. They're coming for pain, vague pain at the elbow and in the forearm. And you have to ask the question, is this clinically relevant? And the answer is not necessarily yes. You just have to guess, or in a case like this, just pass that information back to them and say, they've got pain in that area. If it's irritated by active movement, then you would suggest more, actually, this could well be, when they do this sort of activity. But then equally, these things aren't often necessarily irritable just like this. It's that they'll say, after a long day drive in the car, then it hurts. And if I was treating them clinically in a sort of physio environment, you might see that and go, well, actually, can you try your hands in a different position on the wheel? If you can safely do that without getting struck off if they have an accident. And just see if doing your action in a different position changes the symptoms. But that's a subtle call that I can't back with any research. That's just the sort of thing you look at it in a real patient and you go, I think that might be part of the story.
On the ulnar nerve, John, do you use any type of objective documentation like measuring surface area or long axis, darkness within the fiber or anything like that?
No.
Okay.
I just look at it and I like the look of it or I don't. And
And look, it's snapping.
I think it's thicker, but I would say that they're often, hardworking people usually have some thickening, some chronic thickening of the ulnar nerve as it goes around the corner, but not necessarily. And if they're symptomatic, and I wouldn't say that the lack of it proves that it's not a focal neuropathy with a mechanical cause. I just say, this fits with the story, and because I've seen it both ways, and not ultrasound, I think, reliably tells you whether it's thickened. It doesn't reliably tell you whether that's the cause of the symptom.
That's right.
This is a nice case, I think, just given that we discussed a couple of these things before. Let me just let it run through to the end so that I know, because I've not reviewed them, so I'm not sure what's actually on the video here. But yes, this is, if I come back here and we can just briefly, hopefully, I think there's one point where you will see the recess. Yeah, this is a slightly more ragged wrist. So more arthritic changes of the wrist joint here. And then the synovium there has sort of billowed out of the joint here. And then back here, that's that recess again, I told you, in the mid-carpal joint. So the lunate capitate section there, and where it's thickened. And that's immediately saying to me, yes, this patient has osteoarthritic changes within the wrist joint and in the mid-carpal. But I think this is too much swelling here to be explained by the amount of OA symptoms. And this immediately makes me think about inflammatory arthropathy. And again, you've got your good friend, the color picture. Again, a little bit too much vascularity going on around there to be explained by that, and some here around the wrist joint. But I'm not quite sure what's going on there. Changes to the shape of the bone and swelling here. I think this is the distal ulnar here, and so it's the distal radio ulnar joint capsule coming round here.